Great. Thank you, Jess. Can you hear me okay?
Yep,
Yep.
perfect.
Wonderful. Okay, I'm going to share my screen. Hi, everyone. Thank you so much for making time to be here today. Let me get my slides up. I'm super excited to see a couple of familiar names and faces of folks that I've gotten to work with here in Colorado, where I'm based, and they could do this presentation with me. So I'm excited for them to be here with the group. So today we wanted to talk about, as Jess mentioned, the work that we do at my organization, Community Solutions, focused on solving homelessness. We, as an organization, we are a national nonprofit organization. We have a mission to achieve a lasting end to homelessness that leaves no one behind. And through many iterations of our work, that has always been our mission. But we have been on a learning journey to try and figure out what the most effective tools are and ways of solving problems are to support local communities across the US and through partners in other countries to learn together and to really try to figure out what an effective homeless response system looks like. And so that journey started way back for our founder and others in the organization 20, 30 years ago, focused on permanent supportive housing development. The organization at that time developed close to 4,000 units of permanent supportive housing in the early days of kind of supportive housing and figuring out that intervention to be in support of folks exiting homelessness. And what they learned during that time is that they were having amazing outcomes for individuals who were gaining access to those housing and services. But what was not happening is that the folks that were kind of sleeping outside in New York and Times Square, those folks weren't able to get access to housing and resources. They were still, no matter how much housing was being brought online, those folks were not getting connected with the actual system that was helping to resolve their homelessness. And so the team at that time got really curious about what that meant and why, as we're scaling up housing, we're bringing on these supportive services. What's kind of the mismatch is why folks that seemingly need that intervention the most are not able to access those services. And so at the time that I joined the organization, we were in an effort called the 100,000 Homes campaign. And that was a movement of close to 200 communities across the US that came together to try to figure out how to increase and really transform the housing placement system in communities to rapidly connect vulnerable individuals, oftentimes those that were sleeping on the streets, into housing resources. So to try to really transform that part of the homeless response. And the kind of underlying theory of that effort, which ran from 2010 to 2014, was that if we could just accelerate exits out of our homeless system and get more and more people into the right housing and supports, that we would start to see decreases overall in the number of folks experiencing homelessness across the country. And the data that we had at the time showed that there were about 100,000 people that were experiencing what's called chronic or long-term homelessness. And so the theory was that if all of these communities could rally together and house 100,000 of those individuals, that you would start to see a shift in those numbers, and maybe we'd be able to bend the curve nationally on the numbers of homelessness. And what ended up happening is that those communities collectively housed over 105,000 people in that 4 year time period. Those were folks that were extremely medically vulnerable, again, oftentimes sleeping on the streets, had been experiencing homelessness for a long time, and really came together and worked as a community in a different way than we had historically. And I was on the ground in Denver at that time, supporting the local iteration of that campaign. And we kind of brought people together in a different way and really changed the way that we were doing business to try to make sure that folks that in some ways needed that housing the most were connected with those services. When you looked at the data behind that and go back to that original theory that if we could just accelerate housing placements, we would be able to start to decrease the number of folks experiencing homelessness. The national point in time data for that same time period did show a decrease but it was only about 20%. So we knew we had 100,000 chronically homeless folks. Communities housed 105,000 of them, and we saw an impact, but not at the same scale that we had hoped. And so that learning, that kind of consistent iteration learning what worked, but also really learning what wasn't working, led to curiosity that formed the work that we currently do, which is called Built for Zero. So in 2015, the team decided that we were going to pivot and start to try to work with communities to figure out what would it take, instead of just counting up on housing placements, to make a shift and learn together what was going to be necessary for us to be able to count down to zero. So to get to a place where communities across the country had a shared way of defining and measuring what it would mean to make homelessness rare and brief in our communities, and to then be able to test different strategies and learn together on how we could make that happen. And that is the decade now learning journey that we have been on, and some of what I want to share with you today. Currently, we are supporting a network across the US of just under 150 communities across 30 plus states. Those communities have housed now over nearly 200,000 chronically homeless individuals, veterans, families, youth, other households across their systems. And we have 15 communities that have been able to reach that benchmark of making homelessness rare and brief. We also have other communities that now have, you'll see over 80 communities that have what we call comprehensive real-time data to understand more like a public health data set of who is experiencing homelessness in our community today and what their needs are, and what can that tell us about the trends across our system. And then even though these communities have not yet reached that functional zero or measurable benchmark of making homelessness rare and brief, there are 40 communities across the network that have achieved measurable, sustained reductions over time in the number of people experiencing homelessness for a population. We've also been supporting partners in 5 other countries where we work with other national intermediaries that are then working with networks of communities across their countries to test and adapt and adopt the same model and feed into that overall learning. And in 2021, in the thick of the pandemic, as we all know, we were given the first amazing gift of this effort, which was a testament to the work that all of the communities in the network had been doing, in that we won an award from the MacArthur Foundation, the 100 and Change Award, which gave us a single $100 million grant to be able to support communities over a 5-year period to really lean into testing what was being learned and see if we could scale up those results. That was the first gift and was certainly a gift, but the real big gift of that is that what came with that was the opportunity to have an external evaluation partner ride alongside with us for 5 years and be deeply embedded in our work and connected with communities to learn about all of the strategies that were being tested and to help us really pull that together in a theory of change or roadmap of kind of the best thinking from across the network and the elements that were proving critical for communities that were seeing success of what they were doing in those local places. And so we have, which I think I'll flash up here in a moment, a theory of change that is very wonky, very kind of in the weeds, but a way that we've been able to assess for each of the communities that we are supporting, kind of where they are in that journey of adopting the model. And what it lays out is a really key set of foundational elements for communities. So this is thinking about how communities work together. Do they have the system level and other staffing capacity that's necessary to actually drive results? Do we have data to tell us if what we're doing is adding up and moving in the right direction or not? Do we have person-centered approaches that are making sure that we're engaging with the folks directly experiencing the challenge to learn from them about what solutions are going to be most effective? Once you have the foundations, you're thinking about other strategies, oftentimes programmatic strategies resource strategies? How are we improving our processes to make sure that folks are getting connected most effectively with housing and services? But also thinking about the larger ecosystem that this work lives in, and how are we impacting policies, mobilizing resources, thinking about the narrative that surrounds all of this work and enables success. And then there are a set of things that we can measure that give us confidence that we are moving in the right direction. So are we starting to see our housing placements increase? That is still a critical metric going back, a decade plus ago. It's just not the only thing that we need to be looking at if we're going to really understand change across an entire system. So then we start to see those kind of more intermediate needles move outcomes, with the ultimate North Star being that homelessness is rare and brief for individual populations, so families, youth, veterans, et cetera, but then also being able to take that learning and spread and scale that across our entire system. What that comes to, which I'm not going to read you all of the words on this, but the slides will be available afterwards. And so I wanted to share this for folks that might be interested in going a click deeper, is this overall theory of change that we've been developing with our partners and with communities. And I will say this is not, this is our theory of change, but this is not our theory of change. This is from our communities that we get the honor of supporting, and the learning that they have done on the ground, testing different solutions and figuring out what's going to be most effective. And our role is really to try to give that a container, and to shepherd that, and to try to continue to iterate that collectively as we learn over time. What that boils down to in a much more succinct way than all of those different elements on the last slide, we can think about kind of these 4 foundational capabilities and 5 enabling conditions would be the summary of that theory of change. So 4 foundational capabilities, as I mentioned, that we have learned that is our best theory and thinking at this moment, that every local community is going to need to be able to make homelessness rare and brief, are a backbone organization. And that's what we're going to spend the next 30 so minutes talking about. A backbone organization, the right strategic partnerships. We have to get out of only focusing on kind of historically the partners that were directly in the homeless response system, but really widening that table and bringing more folks into those partnerships. Having collective goals as a community. There are a lot of things that are successful. There are a lot of outcomes that are good, but if we don't get clear together on exactly what we are trying to accomplish, we're never going to know if we've gotten there, and we're never going to be able to course correct along the way if we don't know what we're measuring toward. So having shared set of goals across the community, that's not just one organization, one agency, but that everyone is aiming toward, is critical. And then comprehensive data. Some of you may have been on an earlier session, I think earlier this year, with a couple of my colleagues that did a deep dive into the data work that we do within Built for Zero. And as I mentioned, it's really focused on shifting away from only having once a year kind of update count information that everyone across the country produces as part of federal requirements. That serves a very important purpose and gives us that collective snapshot. But what we need to augment that with is having day to day, week to week, month to month, regular data that we have some level of confidence in, that it's comprehensive enough to understand both what's happening at the individual level so that we can make sure that we're connecting folks with housing and services, but that also we can aggregate that up to look across our system and understand trends. And that's been a lot of people, when they hear about Built for Zero, they think about, it's a data initiative, and it's not, but the data component is critically important to kind of run all the other pieces. So if you have 4 foundational elements, then there are, again, those 5 enabling conditions that are kind of things that are happening in the ecosystem that sometimes we have much less direct control over for folks that are working either in government or local community-based organizations. But nonetheless, they are very important elements that are going to impact everything that we are trying to do. So thinking about supportive policies, what is the narrative around this issue? Do people think that it's solvable or not? Do people believe that there's, certain ways that are more effective than others to solve this problem? Mobilizing resources, and I think trying to get out of only relying on traditional funding streams. As we know, there's always potential for those to change. And we're in a moment right now where I think communities are really needing to think about how are we thinking about resourcing at a system level beyond just individual programs in order to make our systems more resilient to any potential changes. Housing supply, we would be remiss if we were having a conversation about homelessness and not addressing the need for housing supply. I think across the board, people are feeling, as you all know on this call, the crunch around housing supply, and certainly folks that are extremely low income and currently are on the verge of experiencing homelessness. And so it has to be part of the conversation. And then political will. We've all seen the impact that can have in our community in getting folks aligned and really making this work a priority, bringing everybody to the table that needs to be there. So these are the kind of general conditions that we are operating within and that we have learned are critical for local communities to be paying attention to in their work for those folks that are actually seeing reductions in their systems or have been able to make homelessness rare and brief for multiple populations. We have a couple of communities now that are on the verge of doing that across their entire system. They have already reached that benchmark for multiple populations or are in the final stages of being able to house all the other folks in their communities. And so we have a good degree of confidence that these are on the right track. We know we're going to continue to learn, but that these are the core elements that places need to be thinking about. And then once someone reaches that milestone, sustaining becomes the whole picture. We can't just build a system that can solve something one time. This has to be a shift in the way that we support our neighbors, deliver services, work together, if we're going to be able to hold those gains long term, and ultimately be able to start to look further upstream to more and more focus on preventing people from experiencing homelessness in the first place. So what we want to do today with that foundation laid, I know that was a quick flyover and a lot of information, but wanted to kind of give the background on how we got here and now go a little bit deeper into talking about the importance of having a backbone organization. So you saw on the earlier slide that one of the foundational elements is having a strong backbone that can really facilitate this work. And something that we have learned over our years of supporting folks is the need to not only have that strong backbone operating at a local area to really be in the day-to-day of supporting individual operations within the communities drive strategy forward, but this idea of having a more stacked civic infrastructure where we have local community efforts and backbones that are working supported by, in many cases, depending on the geography, a regional intermediary or backbone organization that can help roll all of those local efforts together. I think we all know that people experience community in different ways, that it's not tied to sometimes arbitrary geographic or administrative boundaries. And so where we have regions where people are, connected by transportation and economics and employment markets and housing markets, that we're thinking about how we are building systems through regional backbones that are tying those efforts together. And then you layer on top of that the really critical role of state government. And that is something that, as a team, my team has really been leaning into over the last 6 years or so. I think historically, when you think about homelessness response, so much of the focus has been at the federal level because of funding, and then certainly at the local level as the folks that are in there day in and day out supporting our neighbors to do that work. And states have had a role with different funding streams that have gone through states, but I think it's already was becoming critically important, that states were kind of stepping into a slightly different role. And I think we're seeing that even more today with kind of shifting priorities at the federal level. So we set out about 6 years ago, and with a couple of my colleagues that are on the phone, working in Colorado with the Department of Local Affairs Office of Homeless Initiatives to kind of try to get curious about what is the role of states in this ecosystem. What would it look like for a state agency to be more of a backbone organization supporting local communities and their work? And so that again, it's all about learning. We've been on this learning journey of really trying to figure out how to best support both state and regional backbone organizations to then be able to catalyze the work that's happening on the ground. Right now, we are working in 7 states. So Colorado, as I mentioned, also partnering in Maryland with the Department of Housing and Community Development. Kansas is an effort that is connected, a partnership between the Kansas Statewide Homeless Coalition as a nonprofit organization with the Kansas Department of Aging, that they have worked together to provide the backbone support that's needed there. We have a new partnership in New Jersey with the Department of Community Affairs, in Illinois with the Office to Prevent and End Homelessness, Washington State Department of Commerce Office of Homeless Youth, and then Maine Housing, which is the state housing finance agency. And I think I saw we had at least one person on the call from Maine as well. You'll see that most of these are government organizations, and that is not on accident. And this has become, I think, one of the most common questions that I get as we think about what it looks like to be an effective intermediary or backbone organization. And people ask, is it better if it's government or if it's not government? And from my experience and what we have learned, there is not one right answer to that. It truly is about the kind of functions that need to be in place. And I'll show you those here in a moment, and how you're thinking about showing up to fulfill those functions. I think government, regardless, has to be a key partner. And so it's either, in the case of Kansas, if this function is not living within a government agency, it has to be in direct hand in hand, day-to-day partnership with that community-based organization for it to really have the support and positioning that is needed to truly be able to make an impact and support local communities. At the regional level, we have been initially, again, I'm based in Denver. I think we said that. And so it was very, very lucky to be able to work both with the folks in Colorado, but also in the metro area where I live with the Metro Denver Homeless Initiative, where we've really tested out this backbone role. And I'll use them as an example here in a moment, but also working in King County, Los Angeles County, in the metro, DC, Maryland, and Virginia area through the Washington Council of Governments. And then we're also doing work in Oahu. Okay, so what does all that mean? And what have we learned from these places? As I mentioned, there's a lot of fragmentation, I think, as you think about different geographies, different administrative boundaries, kind of how things get coordinated at a local level can be very challenging, especially if you're sitting in a state or regional leadership role. You're going to have, as you look across your state, different levels of data comprehensiveness across communities across the state. It's really hard to know apples to apples what is true across places and to be able to compare that or have some confidence in that data. Everyone is defining success in different ways. We talked about the importance of having a shared goal. So what it looks like in one corner of the state, might be very different in how folks are thinking about it in a different area. And so it's hard to be able to align what we're doing and to know how to best allocate resources, kind of in absence of some alignment across these places. So you all, I know we have some folks maybe operating at different levels, so wherever that is. If you don't have those foundational elements, you're probably, again, trying to make decisions based on limited data. having competing incentives and expectations from different areas of, where should we be aligning? What should we be prioritizing if we've not all agreed on what we're trying to accomplish together? Policy decisions that it's hard to kind of rule in or out if this is going to be the best thing for what we're trying to accomplish. And then I think one of the biggest areas we've seen is, and this is true at all levels, local, regional, and state, is that historically staffing has been focused on programs, and that's tied to the way that work is funded within the homeless response system, whether that's shelter, housing, outreach, other services, behavioral health services. We have funding streams that are specific to those individual programs and lanes of work. What we have not had historically is the ability to have what we call system level capacity. So folks sitting at this kind of backbone seat, local, regional, and state, to do the actual work of coordination to try to tie all of that work together. So you have amazing leaders who have tried to figure out how to carry that mantle on the side of their desks on top of their already very full plates. And I think we're trying to move to a space to really kind of prove out the importance of coordination and collaboration and working at that system level, that is work that needs to be named and staffed appropriately if we expect everything to actually add up to a coordinated response. And then lastly, I think what often happens when we don't have kind of these foundations in place and when we don't have a strong backbone organization that's bringing alignment across the work that's happening is we have the potential for quick wins that then won't be sustained in the long term. We have gotten very good, I think, as problem solvers to responding to immediate crises and being able to kind of surge and have quick efforts that have an amazing impact on individuals that need that in that moment. What we need to also be able to do is build a system around all of this that's going to be able to surge every day. That this is just the way that we solve the problem, and then we're able to address people's needs quickly with the urgency that our neighbors deserve, and be able to resolve that instance of homelessness, but that's not just a flash in the pan, that we actually have the system in place supported by the backbone to be able to hold that impact long term. So enter the backbone organization. So we've been doing a lot of thinking about this. Folks many of you might be familiar of this concept from collective impact. A lot of our work, kind of early work that we did has helped contribute to the knowledge base around collective impact. But the real focus on the backbone or community quarterback, as some might call it, that role had not been as central to our work as kind of an explicit priority and thing that we were trying to build. And through everything that we've learned, we've again really tried to lean into that over the last few years to think about how we can best support local, regional, and state backbone organizations to be the kind of quarterback for place-based partnerships. And it really is asking folks to, I think, shift a mindset as state leaders, regional leaders, even if you're in a seat of a community-based organization. I think historically what we've seen is that the kind of nature of those relationships at these different levels were oftentimes really transactional. And that's because of kind of funding mechanisms, requirements of how resources are being allocated or policies have to be implemented that set up these more kind of compliance-based mindsets. And that is what, historically folks had been charged to do. What we have found is that this role of being a backbone requires this shift in thinking and this approach of more adaptive leadership, of really being able to come alongside local communities to partner with, to figure out together what the path forward is going to be, to influence, rather than having direct control oftentimes, and to be able to, in some cases, mediate, bring people together to find common ground where it might feel like we're on parallel paths. How could we start to align and move more in the same direction? So that's been one of the big learnings, especially of working with state partners, is trying to flip that relationship between state and local leaders, where I think, again, state folks are charged with, kind of compliance and monitoring around different funding streams. Local folks are kind of used to, when something new happens, it being more of a top-down approach. And it's like, actually, we need to come to the same table and be working on this in a different way, and figuring out a different dynamic. If we're going to change our systems, we're going to have to do something differently. And so, how do we come and work together in a different way? We were able to partner. Another mini gift that we were given a few years ago is that we were able to do some work with the Nonprofit Finance Fund, who looked at backbone organizations across our network, but also across the network of Strive Together, who some of you might be familiar with. They do similar national intermediary work around cradle to career outcomes. And so they looked across backbone organizations across communities and our networks, and were able to help us pull out these 7 key functions that are kind of the critical system level elements that backbone organizations at all levels need to be focused on, or what they are focused on in the communities that are seeing the greatest success. So these are not surprisingly similar to what you saw in the theory of change, similar areas of what we've identified needs to be true in a local place, is that a backbone organization needs to be thinking about community engagement, network building, how we're bringing people together, then how are we aligning around a vision and a shared goal? Who are the different partners we need to have at the table? How are we going to communicate effectively across those different stakeholder groups? How are we thinking about mobilizing resources in a different way that gets away from, in some cases, kind of my program, but starts to think about our community and what's going to be necessary to do this work at a community level? How are we collecting data and measuring impact to know if we're having the difference that we want to? Building partner capacity. And I will say a shout out to the folks in Colorado who are really leaning into this right now, of how do we start to build capacity all across the different partners, whether those are frontline folks, senior leaders, kind of everyone that's in this system, to really have the tools for problem solving that are necessary to do this really complex work. And then organizing for systems change. And as you go back to the question of, does this need to sit in government or sit in a community-based organization? I think one of the most important takeaways, if y'all remember nothing else from what I say today, would be, 1, that homelessness is solvable, and 2, that a backbone organization needs to ensure that all of these functions are in place, but they do not need to do them all themselves. As you get into a more complex environment, kind of having more of a central backbone rather than a coalition format can be, I think, helpful for economies of scale and for efficiency. But the critical role here is that you have someone in, I'll use our example at a state agency, that's thinking about all these things that need to happen, these different functions, but they themselves are not going to be in a position, as we think about more traditional advocacy, to kind of be the lead on that function. But they're building the table and bringing the right people together so that the relationships exist and community partners can be working together to align around the things that they need to advocate for in service of their goals. Another key part of kind of how these functions start to come to life, and a key role of the backbone organization, is helping think about governance and decision making, whether that's at a local, regional, or state level, getting clear on what the different tables are going to be that are going to do different parts of work. How will those all connect to each other? And then how does the backbone support the functioning of those groups? Someone needs to create agendas, facilitate those meetings, keep people on track, project manage, do all the follow up. I think a lot of times what happens is that we have amazing ideas, we have amazing policies, we have all the right kind of vision and intention, and implementation is where things fall apart. And so the backbone is helping with input from the community, kind of create the right spaces for these conversations around the different functions to happen, and then really supporting the implementation of that work. Another slide with lots of words on it that you'll have as a follow-up. But we took all of that learning around just the work that we've been doing with partners, those 7 key functions, and then developed this theory of what a backbone organization in a region or a state needs to be thinking about and focusing on to be able to help move the work forward, with the ultimate goal being that we're driving population level outcomes locally and across an entire region or state. And this has provided a guide for us to be able to talk to the folks that we're working with and figure out what's already happening, where are the gaps, where can we really lean in and focus the coaching and support and strategy to try to help build that container for the work to be successful. Quickly, in the last few minutes, I just wanted to mention Metro Denver as an example of how this work has come to life. So in that area across the country, all areas are divided up into what are called continuums of care. At the federal level, has divided up the whole country into those. In the metro area, it is a 7 county region that has to coordinate and work together on responding to homelessness. That includes 40 cities, 7 counties, 13 public housing authorities, and 1 VA medical center, which is also a really, really good one and strong partner. But as you can see, and anyone that's familiar with this area, this is all the way from Douglas County, which is a more suburban area in the southern part of the region, to Denver, which has its own kind of urban challenges, all the way up to Boulder, which is just a different community. So you have a very kind of diverse place that we're trying to work across. Our theory is that we needed a central backbone organization to support the effort happening across the region, to be able to create a container where everyone was working towards aligned regional goals and some basic agreed upon elements of what we're trying to accomplish, what is the end goal, how are we going to measure and define what we're trying to accomplish, but that could create space for local adaptation and implementation, knowing that each part of the region and what homelessness looks like on a day-to-day basis is very different. And so wanting everyone to not have to kind of wait for this perfectly aligned regional plan where everybody agreed on everything, which is not realistic, but to have a space where everyone's working towards the same thing, even if they're kind of implementing in a more contextualized way in their part of the region. We identified the Metro Denver Homeless Initiative, which was the existing lead agency in the region, and it was positioned as more of a natural backbone organization, more of a kind of neutral entity, in that they don't do direct service in the area. And so through their leadership and with the input of community leaders across the region, we're able to decide to break the region down into 9 subregions. Each of those have their own leadership teams and kind of direct service teams that are meeting on a day-to-day basis, coordinating the work that then all rolls up to and is supported by the team at the Metro Denver Homeless Initiative that's providing support in those key function areas. I'll go here. So they are regularly convening folks. They work together to get agreement on shared population level goals. They're running communications for the region, supporting folks locally to have the same messages across the region. They are providing system level staffing capacity to be able to do that coordination work and to support each of the individual tables, providing the kind of background support for the data infrastructure to be able to collect and regularly update and use to drive strategy, the data that's being collected. They also are building capacity and are part of the state level efforts to really help build capacity with providers across the state, and then creating tables where folks can come together and think about the messages that they want to share as it comes to advocacy and changing systems. What has happened in that work over the last 5 years is that we now have the first region in the country where we are nearing kind of crossing the T's and dotting the I's of being able to say with a very high degree of confidence that this region from top to bottom has comprehensive quality data because this has allowed them to really assess the accuracy of that data at that sub-regional level. Denver specifically, in adopting this way of working and partnering with others across the region, was able to make homelessness rare and brief for unsheltered veterans at the end of last year, and then also recently reported the largest decrease in unsheltered homelessness in the country for a large city. And then as a region working together and with an initial focus on veteran homelessness, collectively, the group has been able to reduce veteran homelessness overall by 40% in the last 5 years. So it's been amazing as someone who's lived here and been in these different in different seats trying to support the work over a year or over the years that we kind of got out of waiting for the perfect plan, but really focused on those foundational elements and the role of the backbone organization as a way to create that container to start to move everyone in the same direction. That doesn't mean that it's perfect, that it doesn't come without challenges, that we've figured everything out by any means, but it has given us a way to kind of systematically continue to work on those different elements and to know where is our system strong, where do we need to improve, how do we then collectively forge that path forward. Last thing I'll say, and I'll turn it back over to Jess for us to open up questions, and we can share this as a follow-up as well, is that specifically at the state level, as we've been thinking about how to help more and more states establish this framework, we have put together these kind of 4 key elements from a policy perspective, or 4 core recommendations that we think need to be true across all states. So not surprising given the focus of our conversation today, but that every state needs to kind of have that central coordinating entity or backbone organization. Really critical that that comes with some staffing and budget authority. And I think the ability to convene both across state agencies, but across communities and across different stakeholder groups. That we need to establish that comprehensive data that I mentioned and have a way across an entire state to really understand apples to apples what's happening across our systems. And then that we've agreed upon those key performance indicators of what we are trying to accomplish together and how we're going to measure that progress. And then lastly, again, we have to talk about housing supply. I think too often it's become a little bit of one or the other. We either need to change systems, improve systems, or we just need more housing. And I think the reality from where I sit is that it just has to be both. It's not an either or. We need more housing. We know that this is a huge challenge for people at nearly all income levels at this point. And if we only add more housing supply to systems that are not functioning as well as they can be, we're also not going to get the results that we're hoping for. And so it's really pairing those efforts together. So I share these 4 core areas because that's something we're going to be doing more and more work on over the coming months. We're looking at, especially in these first 3 areas, but also around housing supply, different model legislation, different scalable tools, resources, ways that we can open up more broadly what we have learned and working deeply in these states to more and more folks. So more to come there. You'll also have my contact information and would really welcome anyone to reach out if you'd like to. And with that, I am going to stop sharing and turn it over to Jess and see what questions there are.
Great. Well, Melanie, thank you so much. I'm going to stop the recording now.